This is her right knee. That's her kneecap, patella. This is the knee joint. So right here is the joint, right there. Okay. So if I put my finger right in the center of that joint, all I'm going to do is just draw a line straight up. Okay. Just to help you find it. I'm going to draw a line straight up. And when you draw a line straight up, you're going to come to a muscle that sits there. And it's a teardrop muscle. You see it on people who have great leg development. The bodybuilders have it. It's called the teardrop muscle. It's known as the vastus medialis obliquus. Big fancy word. Can you make a leg muscle like that? Yeah. See this teardrop right there? It's outlined here. That's the teardrop. It sits right here. It's going to sit underneath that muscle right there. So I want you to find that center of the knee, draw a line up, and kind of make a leg muscle like that. Squeeze it. Feel that muscle pop out right there. And I want you to put your fingers up underneath that right there. That is a canal that sits there. It's called the adductor. Adductor just means inside towards. Adductor canal. It's also called Hunter's canal. But that's where stuff gets trapped. And nobody ever looks here. Usually because it doesn't hurt there. It hurts in the knee, or it hurts in the hamstring, or it hurts in the calf. So you're going to have that artery come down, and you're going to have the vein as well that sits right here. And when that canal gets trapped, this blood from here is going to go deep. And when it goes deep, bend your leg a little bit, it comes into the back of the knee here. So the blood flow in the back of the knee, called your popliteal behind, is from here. So you'll get choked off behind the knee if you're choked off here. And then if you get choked off behind the knee and you get choked off here, what's going to hurt down below? Anything that wants. The calf is going to get tight and tense. It's going to hurt. You're going to get itises down here, plantar fasciitis, right? All these sorts of itis means inflammation, okay? But this can be really, really super tender, like a very painful spot. Why is it painful? Because stuff is stuck there, muck is stuck there, and then you impact the nerves around the knee, right? So that one, you're going to struggle to find a pulse point on. I just want you to find the spot. So go up underneath that muscle and then do this, kind of go back and forth. Does that hurt? If it hurts, that means it's blocked. How are you doing?
It's all right.
Okay. And we're going to use the techniques I'm going to show you in a moment later to free that up. Okay. Like that's one right here, just a glide like that. Look, what's happening? Do you see this artery and you see this vein? What happens when I do this? What's happening to them? They're moving, right? And I'm opening up space. So I'm going to drain the artery, I'm going to drain the vein, and I'm going to free up the lymphatic flow at the same time. Right? Now, check the other side. Go to your left leg, draw the line up, go up underneath that vastus medialis obliquus, put your fingers right there. Do you feel a difference from one side to the other side? How you doing?
Okay.
She's all right. Okay. Now, when you hit that spot and it's painful, people will show it on the face. They'll grimace. They may recoil the leg away. They may actually send you like looks of "I hate you." I get that a lot. But they're also very surprised of how tender that is. All right. That's a really, really, that's a top 5 spot in my world to always work with anything involved with the knee, the hip, the hamstring, the calf, or the ankle, anything in that leg. All right. Now let's look behind the knee. So popliteal. So remember, the stuff from the inside of the leg, the sea of blood, is going to come deep, and it's going to be right here. Right? And that's going to come into that popliteal artery, vein in that region. And then that's going to split off. Right? So that's going to come here and here, like this. Okay? Like that. Now, when these come down, they're going to branch off, and they're going to split off, and then they're going to change direction. They're going to change names. But I don't want you to worry about that. I just want you to focus on this point. I'm going to bend the leg up a little bit to relax tension behind the knee. There's a couple of places that I address this pulse. So let me show you. There's the crease of the knee right here. I usually will go a little bit above that crease. So I find the crease, and I'll put my fingers above the crease right there, and I'm going to press, see if I can feel the pulse there. I'm going to hold there. If you struggle to find it there, you can go below the crease right here, below the crease right at the calf, because the calf is going to split. The calf has a left gastroc and a right gastroc here, and this will usually go straight down right in between the two right there. That's usually where it'll start to split, and I can check my pulse there. See if I can find it on the left side, see if I can find it on the right side. I don't usually work directly behind the knee because it's pretty sensitive back there. With these techniques, I'll usually go above the knee, or I'll go below. I find the biggest block typically below because of the tightness and tension in the calf muscle itself. So that's usually where I'll do most of my techniques. Now, this is also the area where you have a popliteal lymph node or popliteal lymph node cluster. If you do my big 6 lymphatic reset, this is number 6 because people get a lot of pooling, swelling, edema, inflammation behind the knee joint, and the lymph nodes become puffy or swollen. But what else can be a problem here? The blood flow from here, the blood flow from here, the blood flow from where? Inside of that knee, but also the blood flow where? Higher up into the crease of the groin. Now, what you're going to see later as well is you'll see a mixture of, I'm kind of giving you little teasers as we go. Bend your knees for me. Of the techniques, you're going to see, I'm going to place a finger on the sea of blood spot, and I'm going to place a finger right here above the calf, and I'm going to push those two together, just like this. So now I'm going to accordion technique in towards the center, like this, and then stuff's going to start to flush in this region, like that, and then it'll go, it'll just go out. All right, because that's the pipe, just like that. Very, very powerful. And you only have to hold that for about 10, 20 seconds and you're done. No pain, no discomfort, doesn't hurt. Okay. I don't want to cause any pain or discomfort with my techniques, because if I cause pain or discomfort with my techniques, what happens? Everybody tightens up and they restrict flow again. Okay? Non-painful techniques. So that's popliteal. It's the gist of it is like this. You put the tape on the skin, and the tape lifts the skin, and the tape creates space. Why do I want to create space? Blood flow, lymph flow. Right? And you can put this sucker anywhere. There's a basic cervical spine application. That's one of my all-time favorites, to put that right there. Why do you think that's one of the favorite places for me to put tape? What did I tell you earlier in the day? Sits at the bottom of the neck and in the upper back and between your shoulder blades. Your sympathetic nervous system that feeds blood flow and vasoconstriction to your head, neck, and face. That means neck pain, headaches, eye pain, earaches, ear problem, sinus issues, you freaking name it. That's why we put it there. Right? And you can see all these on YouTube, everybody. They're so simple. Potato taping the neck. There's some cautions for you to be paying attention to when you go through it. You just got to watch out for your skin type. Some people react to the tape, right? Don't do it over open wounds, skin lesions, right over rashes, or if you know you have adhesive allergies, right? But it's pretty basic. You clean the skin. You don't want dirty skin. And you try to lengthen the body part that you're going to tape. So you just elongate the area that you're taping. And you'll see that you want to cut the corners. Why do you want to cut the corners? Because sharp corners, first of all, they look awful. And second of all, they grab clothing. They grab clothing. So it sticks a little bit longer, right? And then the only thing I want you to note is don't stretch the ends of the tape. Don't stretch the ends of the tape. I'm going to teach you what's called a decompression technique. This is the technique that I do over the pulse points. And it helps lift up right at the pulse point. What you're going to do is this. You're going to round your edges. You're going to tear the paper off the tape in the middle. And then you're going to pull the two ends apart. So the stretch is in the middle of the tape. So it's going to look like this. So the middle goes down and you lay the two ends down, right? I'll show you how it looks. I'll show you a really great place to do it. I put this one over the sympathetic point in the arm to help you sleep. So there's the tape. All you're going to do is cut a little piece of tape, right? Then you're going to round the edges. Good, look here. Let me show you a little trick. Watch, okay? It's called measure twice, cut once. So I'm going to put these two ends together like this. So I'll fold it over, see how they're together. And then what I'm going to do is I'm going to round both of them together at the same time. So there's my magic trick. Holy cow, you got both at the same time. All right. So there's paper on the back. I'm going to tear it in the middle. And if you look at the tape, you see the tape, it's got little ridges in there and it's sticky. So try not to play with that too much. And look, it's elastic. I'll stretch it, see? So this thing, if I pull the two ends, the middle pulls back towards itself. You see that? See how the middle wants to come back? So when I do that, most of the lift is going to happen right where I put this piece. So I'm going to put this piece right over the pulse point, because what does that look like? If these two ends come together from the ends, what does that look like? An accordion technique, right? That's what it looks like. That's what it's modeled after, is the accordion technique. So let me show you how much you do it. Okay. So with the tape, there's already some stretch built into the tape because it naturally has a recoil to it. About 10% of recoil is in the tape. And then if I go 100, that's too much. So I don't want you to go all the way. I want you to go from baseline to 100 and then back off half. So I want you at 50%. So baseline all the way, half is 50%. And you're going to place it along the length of the blood flow. So if the blood flow is here and it's going this way, right? That's the direction that I'm going to put the tape. So I'm going to go like this here. I'm going to lift. I'm going to put that down. And then I'm going to rub that right here a little bit, because when I rub it, it activates the glue so it sticks. And then these two ends got nothing on it. Okay. Don't stretch these. If you stretch the ends and you put them down, you're going to irritate the skin and you're going to get a blister and it's going to freaking hurt. Right? So she feels the lift in here already, right? So it's lifting up right there on that median nerve sympathetic point. So I do the left side and do the right side, because this left side calms the left side of the body down. The right side calms the right side of the body down. So now I'm going to take this piece off like this. I'm just going to lay the tape down a little bit and move my fingers over it. No stretch. Then I'll do the same thing on this side. Right. And the first thing that your body is going to tell you is, holy cow, that's freaking awesome. Thank you very much. I really like that. Right. I know it because it says it every time. And then you would do the same thing on the other side. And you can try that for anything that hurts you in the arm, anything in the shoulder, and for the good night's sleep. Might be really helpful for you if you have the tingling and numbness and pins and needles at night.